I want to go ahead and get started today. So welcome everyone to the Society of Thoracic Surgeons General Thoracic Surgery Database, our quality improvement series on reducing readmission rates. Today is Thursday, July 31st. So last day of the month, last day of my birthday month. I guess I could actually stop celebrating my birthday month after today. But so yeah, thanks everybody for joining. On the call with me today from the STS side of things, just a small group of us today. It's just myself and Emily Conrad, Carol Crone, Director of the STS National Databases, Nancy Honeycutt, my STS colleague. She manages the Adult Cardiac Surgery Database and the Intermax PDMax databases, and then Ruth Raleigh, our General Thoracic Consultant. So thanks everybody for joining today. I really don't expect this to be a super long call today. I'll get into everything here in just a moment, but I just wanted to still have today's call, even though we don't have a lot of new information to share. I just still wanted to have today's call just to touch in, give you guys an update on what's happening, what's coming, and then also to give you a reminder, of course, about AQO. I'm sure everyone is aware. Several emails have gone out, but just a friendly reminder that it's coming up in September, the 25th through the 26th. And our GTSD session will be held on the 25th, on that Thursday. Registration is now open, and then everyone should have received an email reminder today that, that today is the last day for that early bird pricing. So if you do plan on attending AQO, try and get that registration in today so you can take advantage of that early bird price. So if you have any questions about AQO, the program, you can contact Emily directly at econrad@sts.org. If you have any issues or questions regarding registration, you can just contact our meetings department at meetings@sts.org. If you're not sure who to contact, you can just email me directly, or you can email our help desk. We'll get you to the right person to assist with your AQO questions. Anything else, Emily, about AQO?
Nope.
Sorry to be on the spot.
No, we're gonna be having some posters at AQO this year. For general thoracic, we'll have some presentations on those, abstracts during the day of the meeting, and then we'll really be focusing on the version upgrade.
Yes, yes, absolutely. So if you want to get a sneak peek of the agenda, is posted out on the website. So take a look and then let us know if you guys have any questions. Happy to answer any of those questions that you have. And we do hope that you join us at AQO. For those of you, we'd love to see you in person in San Antonio. But if not, we completely understand. We'll see you in the virtual component. But just a reminder for that virtual component, it is not a live stream. So keep that in mind. I wanted to change gears really quickly and talk about our quality improvement series. As you are aware, this has been our first initiative for the GTSD quality improvement series. And as you're aware, our topic was on readmission rates, reducing readmission rates. So what are our next steps? So our next steps are for our next meeting in August. What we're going to do is we're going to start wrapping up this initial series. We're going to review the data. So we'll have data to present next month on, were our goals achieved? What did we learn? So with that being said, this is first and foremost my very first time of, my very first time of doing any type of quality improvement series. I do not have a clinical background. So this has been a huge learning experience for me. So thanks to Carol and Ruth and Nancy for guiding me through this process. So I'm not gonna lie. This first series was challenging. But we appreciate you guys, continuing to work hard and working with us. And next month we will be taking a look at the final data, and we again will present what were our goals achieved, and most importantly, what did we learn. So next, we're going to continue our series. So what do we focus on next? One, we want your feedback. And most importantly, too, we also need your participation. We were able to get a couple of people to present for us on this Reducing Readmission Rates series. But it's important that we have your participation and your feedback. So I'm going to turn things over to Ruth for the next part so she can talk about our next steps and what we're looking to focus on next.
Hey everyone, I just wanted to follow up on some feedback that I've gotten. I think there are a couple of sites that are confused about whether they are in, like which data set they're in on the data that was previously presented, whether they're a small site, a medium site, or a large site. If you're still struggling with that, feel free to drop your participant ID in the Q&A, and I can tell you which group you're part of. I will not share your blind and sight ID in the chat so that it stays private. I think everybody has their blind and sight IDs. It's just a matter of some people are confused which group they're part of. If you want to go to the next slide, Leanne. We are just, like Leanne mentioned, really curious about what ideas you have for the next quality improvement webinar series. These are just some topics that I've heard sort of casually suggested. I'd love for people to comment in the Q&A or raise their hand and talk and share what other thoughts you might have. But some suggestions that we've heard potentially for the next webinar are completeness of nodal resection for therapeutic lung cancer resections, which corresponds to the COC measure. Some people want to dig into some specific post-op events, whether that should be air leaks or something else if we end up choosing that topic. Or some people have suggested that we do more of a documentation targeted quality improvement series. So I know a lot of sites struggle with getting ECOG documented in the medical record by their clinicians. ECOG is here to stay. It will be in the next version as well. So we need to continue to improve on ECOG documentation. So I thought that was a reasonable suggestion. So I'm just curious to hear what everybody else thinks would be a valuable webinar topic, or if any of these strike a chord with anyone. Feel free to unmute and talk.
Yeah, thanks, Ruth. While we're waiting, but yes, that was one of the goals for us not to, one of the reasons why we, didn't want to not have today's meeting is we wanted to get some feedback from you guys. Again, like we said, it's the quality improvement series, we really need your participation and, so we can work together and we can learn from one another. So please, feel free to raise your hand, unmute yourself. We, love to talk this through and get your feedback and, make sure that what we do decide the next topic, it's something that is useful for you all. Natalie, you should be able to unmute. So we would love to hear your feedback, Natalie.
Hi, thank you.
Hi. Yeah.
So my question is definitely with the ECOG. That seems to be my biggest hurdle with providers. Are they allowed to do addendums in the note, even if it's like, I don't know, months later to the note, and then we can put the ECOG in, or is that not allowed?
Yeah, no, that's perfectly fine. If they want to addend, their H&P with an ECOG score, you can include that in your abstraction. Ideally, that's what they would do. The other thing you can do is if you're missing an ECOG for a specific patient, if you reach out to the surgeon and ask them for the ECOG, you can record it in a log, like a separate log that you keep, and then you can add it from your log to the data that you abstract. And then in the event that you get audited, you would provide that log in addition to the other resources that you provide the audit team.
Okay, that's great. And then, yeah, because my provider, he does document the ECOG, but the problem is he'll do it for the first note, and sometimes that's a year or more. So he doesn't do it for, following notes because he's already done it for the initial note. So that's why I know part of the the guidance for the STS guidance, it says it has
Mm.
to be within a year.
Yeah,
So that's what I was asking. Okay, that would be great. So I can, I'll send that back to them because they were asking if they could do an addendum or not.
yeah, that's perfect.
Thank you.
Yeah.
All right, thanks, Natalie. We have a couple of questions. I have a question. The next question from Erica, I just wanted to answer this really quickly. Will version update discussions be available in the virtual format? So yeah, Erica, all the AQO content will be recorded and that will be available for the virtual attendees. Again, you know, it's just none of the presentations will be live streamed, so you won't be able to, you know, to tune in on the 25th of, you know, for if you're attending virtual only. But yes, every presentation that is given in person in San Antonio will be recorded, and you will be able to view that in the virtual platform.
I'm gonna say, I'm gonna provide a clarification for general thoracic. Adult cardiac, we're gonna have some breakout discussion groups, and that content will not be recorded as it's like a discussion at a table. Thanks.
All right,
If you're
perfect.
attending AQ, adult cardiac.
Oh, thanks, Emily. And then Christina, I see there's a lot of several comments regarding Ruth air leaks. Christina says air leaks are an issue at her site and would like to explore prevention measures that other sites have implemented to decrease their air leak days post-op, and Mary agrees. Mark also strongly agrees as the air leaks, they impact the length of stay. And then Amanda just had a comment. It was an issue at their facility and an opportunity for a QI project, which allowed them to inspect their options for intervention, initiated the ThoraGuard system for air leak monitoring, which has drastically cut down their air leaks, and it's digital. So we have several votes for air leak. And then Jackie said she would like to review nodal resection. AFib. So let's see here. Anything else? So are there others? I don't know if you just want to do like a show of hands, or you can do yeah, a show of hands, just, you know, showing that you would like to do, that would also be interested in air leaks, or if there anyone wants to speak up and, you know, would you be willing, if you've already done a quality improvement project at your facility regarding air leaks, if you'd be willing to present to the group if we did choose that topic. So obviously we would like to choose something where we have participation, and we could have sites that have improved their air leaks come and present, and, you know, obviously present what you've done at your facility. So Julie also agrees with air leaks. Thank you, Julie. Let's see here. There's a question. I don't know. Was there a question, Ruth, about ECOG?
Yeah, I just answered it. The question was if ECOG is given as a range, what number you should
Okay.
enter, and the training manual indicates that you should enter the lowest of the two values. So if it's like given as 0 to 1, you would enter 0.
Okay. And then
Sounds like a lot of people are wanting air leaks.
yeah. Cool. Okay. All right. Well, that is excellent information. Great to know. Let's see. Air leaks for Natalie as well. At times, your patients are discharged and not seen until 5 days after. Okay. Seems like we have a recurring theme. And there's another question about ECOG. It's ask their surgeons to put it in the OR note under the indication for the procedure. Would this be acceptable?
Yeah, that's fine. Wherever it works easiest for them.
Yeah.
As long as it's a pre-op ECOG. You can't use an ECOG from oncology that's like after the
Yeah.
patient already had surgery.
Okay. Let's see. For the one that was having difficult time getting ECOG scores, we sat down with the NPs and had them build ECOG into the HMP template. Do they complete it every time? No, but the completion rate is much better with that reminder to complete it. So, and Natalie, doctor is asking if if ECOG is part of the risk calculation and if it affects the scores for ECOG.
ECOG is part of risk calculation, yes.
Yes.
If you leave it blank, it gets, I think, imputed as the lowest risk.
Yep, so that may also be some little bit of encouragement for your surgeons to document that, because if they're not documenting, then that patient is not potentially not being risk adjusted appropriately for that ECOG.
So it would, to your follow-up question, it would affect your
Your rating.
quality rating because your patients are not being accurately risk adjusted then potentially.
You're welcome. I'm sure that will help in your plea to get them to start documenting that. Okay. While we are waiting for, it seems like you said, Ruth, air leaks are very, seem to be our common theme. And then also, like I said, today, we didn't have a lot of information, but again, I did not want to not have this webinar. I wanted to talk to you all about, what our next steps and where we are with this readmission project. Again, like I had said earlier, our next meeting is going to be on August the 28th. And what we again plan to do is wrap up this readmission series. We'll present the data and then we'll officially kick off our next series. And then we'll kick off our next series in August, and then we'll have AQO. So we will not have a quality improvement webinar in September, but we will pick back up in October after we kick things off in August for our new series. So with that being said, if you do have any questions, please feel free to put them into the Q&A. If not, just put any questions that you have into the Q&A. We're happy to answer any questions that you may have. But if not, just a reminder that our next monthly webinar is August the 13th, followed up by our September 10th monthly webinar. And then again, our next quality improvement series is next month, the end of August. And then again, we'll pick up in October with our second quality improvement series webinar. So Dia, you're getting, you're trying to access the data dictionary and it says that your access is denied. So we have had some issues with the STS website over the last few days. So we apologize for that. But what you will need to do, if it says your access is denied, if you look up in the upper right-hand corner, there's a login button. So I think when the website was fixed, most people lost their, they were, logged into the portal. So I think you just got kicked out. So if you just click on that login button in the upper right-hand corner, you'll just have to log in again, and then you'll be able to access the data dictionary and the resources. I think that has taken care of the problem for most people. There you go. No problem. It took me a while to figure that out too, because it was happening to us staff as well, and it took us a while to figure it out as well. So, all right. But I don't have anything else. But again, I really did just want to thank you all for sticking with us throughout this this initial series. Like I said, this has been a first for general thoracic and for me as well. So it's been a learning process. But we are looking forward to presenting the data, seeing how things look, and then kicking off our new series, and look forward to the next steps and working with you all in our next on our next project. I don't know if anyone else from the STS side has anything that they wanted to add, Ruth or Carol or anyone, Emily. I just want to be respectful of everyone's time. Anything? Going once, going twice?
I don't have anything to add. This is Carol, but
Yeah.
hi, everybody.
Hi.
No, hi. No, don't have anything to add. Great webinar, Leanne, as always. Good information, and looking forward to the next quality improvement project.
Yeah. And again, you know, Carol, to you and Nancy and Ruth, thank you for guiding me through this process. I promise it'll get better from here. It'll only get better as I continue to learn and just continue to learn and make things better. So thank you everyone for sticking with me.
Yeah, of course.
All right. All right. Well, if we don't have any other questions, I just, want to say thanks again. And here's our contact information. Please feel free to reach out to us directly with any questions. Always happy to help. And with that, I hope you guys have a great rest of your afternoon. And we'll see you on our monthly webinar on August the 13th. So thanks, everyone. I hope you have a great rest. I thought someone had their hand raised really quickly. So I hope you guys have a great rest of your day and just reach out. We're happy to help. Thanks, everyone.
Bye.
Thank
All right,
you.
bye-bye.